Welcome back. October is Breast Cancer Awareness Month, and if you've got any questions around risk factors, self-exams, that's where our next guest comes in. Dr. Audra Cole is joining us from LifeSpring Women's Healthcare, and this segment is sponsored by LifeSpring Women's Healthcare. Dr. Cole, thank you so much for joining us today.
Thank you so much for having me.
Yes. How prevalent is breast cancer?
About 1 in 8 women sometime in their lifetime will have breast cancer, which is a huge amount.
Yeah. That is large. Are there any risk factors and warning signs?
Yes, so there's a lot of risk factors. However, I think it's so important to tell women, even if you don't meet any of these risk factors, it's still so important to have that screening or talk to your doctor if you're concerned about anything. But some of the risk factors include having, things that people don't even think about, starting their periods early before the age of 12, going through menopause later in life after the age of 51, never having been pregnant is a risk factor. And then there are some that we can actually change, like obesity, sedentary lifestyle, alcohol use actually increases people's risk. And then the one that everyone thinks about is a strong family history of breast cancer. Actually, if you have one first-degree family member who has a history of breast cancer, that doubles a woman's risk for developing breast cancer sometime in their life. Wow. And then if they have 2 first-degree relatives, that actually triples her risk.
Okay. That's interesting.
So knowing your family history is definitely important here as well.
Yes, definitely important. And a lot of times with my patients, they're like, oh, I don't need a mammogram. I don't have any family history. Over 75% of women who are diagnosed with breast cancer, though, don't have any family history, so it's really important.
Sure.
And you mentioned first-degree relatives, but what about even going back further than that?
That is also important, and I encourage people to talk to their doctors about that. There's actually even some genetic testing. There's genetic counselors I know at the Breast Center and at Mercy who will actually sit down with a woman and talk to them about their risk, and there are certain genetic tests that can be performed that insurance will actually pay for if they're good candidates.
Yeah. Okay, good to know, because we are hearing more about a lot of women saying, I actually have this genetic strain that is related to breast cancer. I've seen that a lot on social media.
And BRCA1 and 2 are the big ones that people have typically heard about. There are so many others, though, that people have not heard about. One of my nurses, she wouldn't mind me sharing, her mother was diagnosed and had a genetic mutation, so she went and got tested as well, and she also had that genetic mutation. Wow. So, and it was not the BRCA.
Let's talk about screening and how often we should be getting screened to check for breast cancer.
I usually recommend that anybody reproductive age or older in menopause sees their doctor yearly for a well-woman exam, and that should include a clinical breast exam at that time. But also any woman over the age of 40 should have a yearly screening mammogram, and that should be every year. And as long as we're staying on top of it, even if we do find something on one of those mammograms, our chance of catching that early is so much higher, and our survival rates are so much higher.
Sure, absolutely. Dr. Cole, maybe there's some people at home and, we have gone through a pandemic and maybe that delayed them from getting their mammogram or seeking some care.
Yes.
What would you have to say to those patients?
It definitely did. And I had so many patients that skipped a year or 2 years during the COVID pandemic because they were afraid to go into the hospital or anything like that. There are some imaging locations that are not at the hospital either. I know the Breast Center is a great resource, but it's still so important. Even though the COVID pandemic really halted everyone's life, breast cancer was still happening, and actually our diagnosis rates went up considerably during that time and afterward.
Sure.
So.
Yeah, that's interesting.
Are there some things that we could be doing at home? I know some people at home may have heard of some self-exams that we could perform ourselves.
Yes. It's actually really interesting. One of the task force a while back was like, oh no, don't recommend self-breast exams on patients, but I usually do for all of my patients, and the American Cancer Society actually recommends that as well. Just doing a monthly home self-exam. I usually recommend, because breast tissue can change throughout a woman's cycle, that they do that at a certain time of the month, every month, so that they have something to compare it to a little bit easier.
We hear a lot about early detection.
Yes.
How important is early detection?
Oh my gosh, it's so incredibly important. And I mean, if we catch this at a lesser stage, the chances of survival are so much higher.
Sure.
So,
That's great.
Dr. Cole, how can we reach out to you if we want to make an appointment or schedule some time with someone at LifeSpring?
Yes, we are all over social media, and you can Google LifeSpring. We are in Bentonville on the corner of 28th and J Street. I work there. We have 2 amazing nurse practitioners and 2 other amazing providers who will be happy to see you. And I encourage you, whether you see us or anybody else, to just make sure that you're voicing your concerns to your doctor. So even if you don't meet any of those risk factors, even if you're less than 40, if you have a concern about anything, we are more than willing to listen to you and to take you seriously about this.
Sure.
Yeah.
Dr. Cole, thank you so much
Thank
for
you.
joining us
Thank you
today.
very much.
Appreciate
Thank you.
We do, yeah. Well, and thanks to LifeSpring Women's Healthcare for sponsoring this
Yes.
segment.